Good afternoon. Thank you, Jody, for that introduction and for holding this event in such a fitting location. Thank you, Governor Culver, for the invitation to speak today and for your commitment to cover all children in Iowa with the health care coverage they need. I want to also thank the legislators who worked for months on this bill. Senator Jack Hatch, who introduced this bill and saw it through to the end. Senators Bolcom and Seymour, who served on the Senate subcommittee. In the House, Representatives Mark Smith, Linda Upmeyer, and Lisa Heddens, who worked on the subcommittee and ushered the bill through the House. I want to graciously acknowledge the advocates who worked on this bill every day. As a state, we benefit greatly from the passion, expertise, and willingness to serve each of you possess. This bill signing gives us a moment to celebrate. This legislation is another important step in the journey toward ensuring that all Iowans have health care coverage. This bill creates the Legislative Health Care Coverage Council that will address the issue of uninsured adults in Iowa, over 300,000 people. The deadlines and milestones in the bill should result in major progress toward covering adults, something that grows more important each day as more Iowans go without health care coverage. Congress may pass comprehensive health care reform, but we know that much will be left to the states, and we believe that Iowa is well positioned to take on that responsibility. With the passage of Senate File 389, Iowa leads the nation when it comes to reform for children's coverage. One thing we know about children and their health and development, if you don't get it right the first time, you can't go back and correct it. Getting it right the first time will save us millions of dollars. In fact, in last Friday's issue of Academic Pediatrics, researchers at Johns Hopkins show that early childhood health interventions can save billions in later health care costs. As a state, Iowa is committed to getting it right the first time. This is what Senate File 389 will do for children. Cover lawfully residing immigrant children. Cover children and pregnant women up to 300% of the federal poverty level. Create a dental-only option under Hawkeye. Streamline enrollment and retention to keep kids covered. This will assure that children have medical homes and receive preventive care. This bill focuses on efficiency and removing unnecessary expenses. The simplification measures in this bill will take work to accomplish and are the last piece of the puzzle. As we all work together to implement the language in this bill, we will depend upon the continued leadership from the Iowa Departments of Human Services and Public Health. I'd like to thank them in advance for their efforts. Our legislators deserve credit for listening to what families are facing in these most trying economic times and for responding to them. This bill is a solid example of when government works well, when legislators, the governor, and state agencies work together to accomplish what is best for children, families, and all Iowans. I am proud to have worked on this bill and to be a part of this event. Iowa is leading the nation in these efforts, and for that, all of us should feel proud. Thank you.